Hi, my name is Amelia Kirby, and I will be speaking about the Nursing Planetary Health Report Card pilot that was launched with the help of many nursing students and nurses. But for this poster, Ryne Wilson, Leonie Harris, and Nadia Corner were instrumental in helping put this poster together for this conference. So many of you attending this conference will be familiar with the Planetary Health Report Card, but it was started by a team of medical students at UCSF and was created to serve as an assessment tool for medical schools to gauge their institution's dedication to climate education. After a conference hosted by UVA in 2020, excuse me, many nursing students and nurses who attended the conference became interested in this project and realized that nursing and nursing schools were in an ideal position to adapt this incredible tool to the nursing education and practice. The nursing role provides a unique angle with which to approach planetary health. Nursing includes an enormous amount of face time with patients and the patient populations being most affected by climate change. Upon spreading the word of our interest, we soon found ourselves with an international team ready to take on the task. So working off of the medical school planetary health report card, we began shaping our metrics to best reflect nursing school curriculum and scope. Our biggest challenge was in specifying the metrics to nursing, yet also broadening the metrics enough to encompass the varied degrees and programs that all funnel into a nursing career. For example, in the US alone, there are associates, bachelor's, and master's programs, while the international schooling has an entirely different tier of practice. We did our best to incorporate these elements into our metrics and the scoring, and we think that it reflects that well. The programs are scored in the different metric areas of curriculum, interdisciplinary scholarship, outreach and advocacy, student-led initiatives, and sustainable practices. So after a many month-long process of putting this together, in April of this year, we did our first pilot, and the pilot program included University of Minnesota, Richmond, Virginia, one program in the United Kingdom and a program in Germany. And we were able to gather a ton of feedback about the inner reliability of the report card and basically edit it and fine tune this tool to be used in years going forward, because it's important to know and consider that the Planetary Health Report Card is an annual tool, so you can see how your programs have grown or not grown and track that accountability as these students go through these programs. The results were really interesting and really helpful for all of us. I know that we all learned a lot about our programs and especially the areas that we could improve. So in our conclusion, our team found that this was a very successful pilot, especially because we found that this is a broad enough document, but for nursing students and nursing programs specifically, that it can be useful. Almost all of us found that our faculty and leadership were receptive to the report card, and we used it and really emphasized that instead of these ratings that were given A through F with the supporting evidence on the report card, that it wasn't demerits and it wasn't meant to shame programs, but it's to incentivize them to improve their programs. And most of us found a lot of support from our faculty, and some of us have even seen these improvements already being able to put on next year's Planetary Health Report Card, which the process has already started. And soon they'll be rolling that out, and those results for the next year will be published in hopefully Earth Day of 2023. But we want to thank all of our amazing supporters, Teddy Potter, Heather Bide, Norma Huss, and Elaine Hill, who are also integral to this project, and all of the nursing students that help implement this, because at its heart, it is a student-led initiative, and that's something that we're really proud of, and it's easy to use for all these different programs and nursing students. Thank you so much for hosting us, and we're really looking forward to learning more at this conference and interacting with all of you. Thank you.